This is Nigeria News Update today. Imagine a community where the very air you breathe and the ground you walk on could be poisoning your children. That's the terrifying reality for residents in Ogijo, Ogun State, right now. But here's the twist. After months of international pressure and local fear, the government has launched a massive health operation. Coming up, you'll discover the shocking reason why 7 factories were shut down, how over 500 people are now being tested for a silent killer, and what this means for every Nigerian community near industrial activity. Meet the residents of Ogijo, families who have lived for generations in Sagamu Local Government Area. In November of 2025, their world was turned upside down. The Ogun State Government took the drastic step of closing 7 factories in their community. The reason? These facilities were involved in lead-acid battery recycling, and there was a growing, terrifying suspicion of potential lead poisoning in the air, soil, and water. For months, families lived with an invisible threat, not knowing if their children were being slowly harmed. But here's what nobody was talking about publicly until now. The international spotlight had turned on Ogijo. Reports from foreign media organizations placed this Nigerian community in a global health conversation, forcing a coordinated response. The stakes couldn't be higher. Lead exposure, especially in children, can cause irreversible brain damage, developmental delays, and a lifetime of health problems. The community's fear was palpable, and the government's credibility was on the line. So, what did they do? The state deliberately adopted a scientific approach. His Excellency, Governor Dapo Abiodun, gave a direct order. He instructed that the Nigerian Institute of Medical Research, known as NIMR, be engaged to independently conduct the entire health study. The goal? To ensure absolute authenticity, transparency, and global credibility of the findings. This wasn't just a local checkup. This was a statement. Commissioner for Health, Tomi Coker, stated that NIMR is working completely independently to deliver unbiased results. And here's the part that will blow your mind about the scale of this operation. The NIMR team commenced fieldwork in the community last week. They didn't just test a few people. Using a stratified scientific methodology, they have already collected blood samples from more than 500 scientifically selected residents. They targeted specific high-risk groups, individuals previously flagged with elevated blood lead levels, pregnant women, lactating mothers, and children within the carefully mapped danger zones of Ogijo. This is a forensic-level health audit. But the story doesn't end with blood tests. While the Health Ministry moved in with its teams, the Ministry of Environment was conducting its own parallel mission. They proceeded with comprehensive environmental audits and assessments of the area surrounding those 7 shuttered factories. The government's message was clear: we're tackling this from both the human and the environmental angle. The community engagement began at the Ogijo's Palace, a sign of respect for local authority, before the medical teams fanned out into the neighborhoods. Now, all of Ogijo waits. They wait for the results of those 500 blood tests, which will determine precise blood lead levels, or BLL. They wait for the environmental report. And they wait for the final, independent report from NIMR to be submitted to the governor for what Commissioner Coker calls necessary action. The implications are massive. This case sets a precedent for how Nigeria handles industrial pollution and public health crises. Will the companies be held accountable? Will the affected residents receive compensation and long-term medical care? Some say this is a bold step toward environmental justice. Others worry it's too little, too late for those already exposed. The controversy is just beginning. One unanswered question hangs over everything. If the lead levels are as high as feared, how did it get this bad, and who is truly responsible? We started with a community living in fear of an invisible poison. Now, over 500 blood samples hold the truth. The independent scientists are on the case. But the wait for answers is its own kind of agony. Do you think this health audit will lead to real justice for the people of Ogijo, or is it just a political response to bad press? Drop your take in the comments. Subscribe to Nigeria News Update today for more breaking news that impacts your health and your community.